As a caregiver, you are providing support for an elderly loved one whose health has declined to the point that they need help with their daily activities. Take the 85-year-old man who went to the doctor about the pain in his left knee. After explaining his symptoms, the doctor replied, "The problems you're experiencing are normal for an 85-year-old man." "That's funny," the man replied. "My other knee is 85 too, and it's doing just fine."
Western Kentucky University's gerontology program presents Understanding Health and Aging.
Aging can result in many physical and mental changes. Some of these changes are normal and expected. Some are signs of problems that need special attention. Deciding whether a complaint is age-related or one that needs special attention can be frustrating and confusing for caregivers. The purpose of this tape is to increase your knowledge about physical and mental changes of the elderly and help you make wise health care decisions. Also, increased awareness of the health needs of your care receiver may help decrease the stress and frustration of caregiving. In addition, this tape will help you identify some health care resources available to you. We'll be joining a caregiver support group that is discussing some of the health care problems they have faced while caring for a loved one. Dr. Jane Tebow, Assistant Professor of Family Medicine and Gerontologist from the University of Louisville, will be answering those questions. Let's join the group now in progress.
Any other questions?
My husband's forgetfulness is driving me crazy. Now, I would like to keep him home as long as possible, but lately a lot of friends are telling me that this forgetfulness is a part of senility in aging. Is it?
Thelma, one of the most commonly held myths about the aging process is that senility or forgetfulness is normal. It is not. Okay, now, let me talk a little bit about why it is not. First of all, if you experience a forgetfulness, or if your husband does, that interferes with your life, with the way you live your life, then that is abnormal forgetfulness and should be evaluated by a physician. It's usually a sign of some kind of disease process. Now, that disease could be curable or it could be not curable. The not curable kind you know about as Alzheimer's disease. The curable kind is that it just could be an infection that's causing the memory loss, and it needs to be evaluated. Now, with the other kind of forgetfulness, the one that doesn't interfere with life, there are a number of reasons why you experience it. First, in the normal part of the aging process, we do have a change in the way we remember. It takes us longer to recall things than it did, say, when we were 20. And lots of times people misinterpret that as being forgetfulness. It just means that it takes longer to get the memory out of our mental computers. Okay? Now, if in fact there is a forgetfulness, it could be caused by depression. At any stage of the lifespan, if you're clinically depressed, you will experience difficulty thinking and remembering. Another reason for for memory loss can be medications that a person is on. Some of the medications that folks are on actually do cause confusion, so you need to look at that. Another reason for memory loss is anxiety. To the extent that you're anxious or worried about something or have too many things on your mind, you block those memories. And a fourth reason for memory loss is poor thinking and memory skills. Very often after we retire, we just sort of give up all of those tasks that we do to keep our minds sharp. We don't try to remember telephone numbers, for example. We don't work on carrying out problems. And we lose those skills. So we can really make ourselves look as though we're becoming clinically forgetful by not keeping up with those skills.
Are you saying there's things that I can do to help or reverse this forgetfulness?
Definitely. And again, it depends on what's causing the forgetfulness. First of all, it's always a good idea to get a good medical evaluation to rule out any physical or disease cause for the forgetfulness. Okay? But once you've done that and you've found that there's nothing wrong physically, then what's called cognitive skills training is a good thing to start. And it's a big word, but it really means just using your brain as much as possible. In memory jogging, actually, is what it is. Just like one jogs physically, you need to do the same thing with your mind. And there are programs you can get into, but if you don't want to go that far, things like doing crossword puzzles, even though you may not like them, doing exercises such as memorizing bits of poetry every day, or scripture, or whatever is interesting to you, making sure that you think through problems. One of the main losses that we experience normally is the ability to fantasize, to daydream, to make mental images. And we'd rely on those images very much in our day-to-day living, in our memories, and in our problem solving. So if you can take some time every day to just sit back and form mental images. For example, take a trip to Hawaii in your mind and visualize the beach and the seagulls and the waves and that kind of thing, and visualize yourself there and make it as detailed as possible. Just spending some time every day doing that. Memorize your friends' telephone numbers, okay? When you're wanting to remember things in the grocery store, when you're making a shopping list, sit at your kitchen table and make a mental trip through the grocery store, through every aisle, trying to remember what's stored on every aisle, trying to remember what you need in your own kitchen. Okay? All of those things will contribute little bit by little bit to your memory and thinking processes. Do this with another person. Compete with another person in terms of memory. Read your newspaper, then put it down and try to remember and state aloud what you what you read. Same way with television programs. What was actually said? What was the plot of that story? It'll feel artificial at first, but it actually will help over the long run. Remember that. Remembering is a use it or lose it phenomenon. If you don't practice it, you're going to lose those skills, just as you'll lose your muscle skill and your strength if you don't exercise.
What about headaches? Mom complains all the time about headaches. We've had the doctors look at her. They can't find anything wrong. She still complains about headaches. Are they real, imaginary? What's causing it?
Jim, there are a number of reasons for having headaches, ranging all the way from brain tumors to tension and anxiety. If you're reasonably sure that she's been well evaluated medically, and that would include maybe a CAT scan or an MRI, as well as the more general kinds of evaluations, including allergy evaluation and so forth, then we need to think about some other causes. And the first thing that comes to mind is that perhaps she's depressed. Headaches or any other bodily symptom are very, very often seen when someone is depressed. And lots of times, depression in the elderly doesn't even show up as great sadness, as we usually think about it. Most of the time, it shows up as preoccupation with bodily symptoms, with the stomach, with the head, any other ache and pain that arises. The person will focus in on it and blow it way out of proportion. We'll experience it, but it will be out of proportion. And that's one of the classic signs of depression in older adults, and that needs to be evaluated by an appropriate person. So that's one thing. Another is tension or anxiety. As you know, if you've ever had a tension headache, if you've been really tense at one point or another, that can cause a headache. And if there's any kind of stress in her life that perhaps she's not sharing with you or someone else, this could be causing it. Just the very fact of having one real bad headache can cause one to worry about having another one and can create that cycle. One of the things that you might want to consider if you think that it's psychological is having her talk to someone she trusts, whether that is a minister or another kind of clergy person, or a counselor, social worker, or even a psychiatrist. Because if it is depression that's causing this preoccupation with her head, then she may be able to be treated medically for it. And you really do need to keep taking it a little farther down in terms of evaluation to see what's causing it. Okay? Okay. Mary, do you have any questions? We haven't heard from you this afternoon.
Well, I do have a problem. My mother-in-law refuses to eat the food that I prepare for her, even though she has just requested it. Now, why does she do this to me?
There could be a number of reasons. Let's start with the simplest and then work up to the more complex. The first could be, and I don't know the quality of your mother-in-law's memory, but it could well be that she's forgotten that she asked you for these particular foods, and that when she asked you for them, she was hungry for them, and now a little time has elapsed while you prepared for them, and she's forgotten that she was hungry for them. Okay, that commonly happens. The next one, and it's probably more likely, is that she has a memory of what that particular food tastes like. And she remembers that she wants, say, for example, some spaghetti, and she remembers what it tastes like. And you put it in front of her, and because of the loss of taste cells, because maybe of some of the medications she's on, it just does not taste the way she remembers that food to taste, and she loses interest in it. It doesn't, and she gets angry with you maybe because you just can't follow a recipe, or you don't make it to suit her taste. And the likelihood is probably that the memory of what it tastes like does not correspond to what she's actually experiencing. Another reason could well be some anger towards you. Sometimes as we age and we have very little control in our lives, what we focus on is food. College kids do this all the time. They complain about the food in their dormitories or in the cafeteria because that's the only thing they seem to be able to control in their lives. And the same is true with people in nursing homes as well as people who are losing control over situations in their lives. Food is the easiest thing to complain about. And very often you'll find that people would just concentrate on that when there are really other issues that are at hand. For example, your mother-in-law really might like to do some of the cooking herself, but because of the competition between women and kitchens and personal space and so forth, she may feel that she's intruding into your domain if she cooked. So you might want to just sit down with her sometime and just talk about what foods she likes and how she would like them prepared. Ask her if she has favorite recipes, and then ask her if she would like to do some of the cooking herself. Keep also in mind that there are things that interfere with appetite, and most of the time that's illness and medications. Mm-hmm. And some of those can be interfering with her appetite and the way she experiences food. Okay. Anything else related to that or any other things?
Those are really helpful examples, and some do apply. Mm-hmm. Another thing that's really frustrating to me, the doctor has had me to lower her diet in fat and salt. Mm. Well, in order to try to encourage her to eat, I have rearranged my whole family's diet. Now they are complaining about the diet, and at the same time she is not eating either. So what can I do here?
And so everybody's furious with you, right? Okay. Mm-hmm. First of all, I think what I would do is go back to serving my family their regularly liked foods. Okay, I don't think that, even though it's probably a healthier diet for them, I think you really do need to honor their food preferences, and the whole family doesn't have to change because one person does. What I would do with her is have her make out a list of all of her favorite foods. Okay, what does she like to eat the most in an order of preference, okay? And then see whether there are substitutes for those tastes. For example, if she likes ice cream with a high fat content and generally goes to that kind of ice cream, is there another ice cream that she could be eating that's really ice milk or yogurt or tofu or some of those very, very low calorie or low fat kinds of tastes, just to make sure that she gets the kind of sweetness, for example, and that she likes. You don't have to completely do without foods. Some of the salt substitutes, if she's allowed to use those, are fairly palatable. Using lemon juice on foods actually makes the food taste saltier, so that you might want to try, letting her know some tricks to make the food taste more palatable. You might want to take her to the grocery store and let her choose some spices and some herbs, because these things can give food much more interest and can help her spark, more interest in foods. Especially, you might even get her to grow some herbs in your garden or in the windowsill in the wintertime, so that she gets involved in that whole process of making eating more interesting. The more control that she has over her diet and eating, the better. You might want to take her to some of these new French restaurants that have the nouvelle cuisine, which is low fat, low salt, low calorie French cooking, and just get her into some gourmet eating rather than have her think that she's a patient and has to deny herself. There's there are fine ways of eating on these kinds of diets that don't seem to, so that the person doesn't have to feel that they're an invalid or that something's wrong with them. That in itself might spark the rest of the family into taking a look at the way it eats, and you might ultimately convert them all to healthy eating without imposing it, but making it an adventure. But the key here is to give her as much control over her eating as possible. Have her think that it's her idea to try different things. So give it a try. Again, no one thing is going to be the ultimate answer, but a series and a group of ideas might help. Good luck.
Okay.
Okay.
Recently, my husband became confused, and we took him to the hospital. And they told me he was dehydrated. Now, does this dehydration cause confusion, and how much water should I give him a day?
Okay. Dehydration can cause confusion in later life, particularly because it upsets the chemical balance in the brain. And therefore, the people can become confused or agitated and have many kinds of psychological symptoms. The issue of the water is kind of interesting because it's really hard to tell exactly how much water any one person needs. So you go right back to your grandmother's old advice. 8-ounce glasses of water a day is about what you ought to be striving for. And I know that's hard for people to do. And it's unbelievable how quickly you can forget how many glasses you have drunk and think you've had the whole 8. So what I would suggest that you do with your husband is fill a gallon jug every morning and put it with water and put it into the refrigerator. And just make sure that by 10 o'clock that night, he has had all of that to drink. That doesn't mean that he has to go to the refrigerator 8 times and drink 8 ounces. He can have 4 ounces or 2 ounces or, you know, as much as you feel like having at the time, just as long as you make it a habit and you know how much you've had. And I would suggest that you try that too. Every one of us at all ages needs to have that much fluid each day. And I know the next question you're going to ask or you're thinking is coffee okay? Can I hate water? Coffee's what I want? Is that what you're going to ask?
That's
okay.
what I was thinking.
Yeah. No, coffee won't do it. Even decaffeinated coffee won't do it, and diet drinks won't, and so forth. You really need that water. Now, all of those things do add fluid to your body, and that's good. But keep the water as your baseline, okay? And you'll get used to it. Okay. Is there anything else? Any other questions that we haven't talked about today?
Well, my mother-in-law takes so many different medications. Could anyone possibly need 19 different ones?
Well, I'm not her physician, so I'm not going to say one thing one way or another about her particular situation, and we do encounter that now and again, but that does seem excessive. And what you might want to do is inform her physician of the number of medications that she's taking. Mm-hmm. He may not even be aware of all of these, because some of them may be from some other physician that she's gone to without his knowing it. So, number one, you need to do that. Secondly, that many chemicals going into the body on a daily basis is really a lot of chemicals and can cause all kinds of interactions with themselves in terms of drug interactions, as well as having very potent side effects as far as the body is concerned. One of the things that older adults tend to do is doctor hop. And they will pick up a prescription from one, and then they'll go to another physician and pick up another prescription. And then they have 19 or 20. I even encountered one with 27 different medications that she was taking on a regular basis. And they won't go back to the physician, but they'll call the pharmacy. And very often the pharmacists, if it's a prescription that is renewable, will just automatically, will call the physician will automatically renew it without seeing the patient. And so people can end up on enormous numbers of medications, many of which are very similar. We had one lady in our clinic who was on 4 different types of antihypertensive medications, and she only needed to be on one. And so there really needs to be a system of checks and balances to see, to regulate this. So I would advise you informing your physician, her main physician, as to all of the medications, even the ones that are over the counter, the things that she buys herself in the drugstore. I think that's very important.
You're talking about medications. We decided that Mom needed a physical, and so I called, made the appointment. Nurse said, bring in all her medications. Why?
Because invariably you will forget one if you just write them down. Secondly, there are a number of things on the bottle of the medicine that are good information, or information that the physician needs. Number one, who's the other physician who prescribed this? What's the date that it was prescribed? What's the name of the medication, and what dosage should be given? And then you open up the bottle and you look to see whether the medication that's actually in the bottle corresponds with the name on the bottle. So you glean a lot of information just by taking a look at the bottle. Secondly, in addition to just having information about prescription drugs, hopefully the nurse asked you to bring in all of the things that are over-the-counter drugs that she takes also. And having all of those together, taking a look at what may interact with another, what may be a drug that's too old. For example, a drug called tetracycline, which is an antibiotic, can go out of date. Very often people don't take the whole round of antibiotics that they're supposed to, and they have a few left and think, if I have an infection, I'll just take a few of these. Well, in fact, they get stronger as they age. And if they're out of date, they can become very toxic to the person. So all of that is information that the physician needs in order to be able to find out whether the medicines are appropriate. So it's much better to bring them with you.
What about communication with the physician? How can we improve that?
That's a very often asked question, and because I teach physicians how to communicate with older adults, I'm really concerned with teaching older adults how to communicate with their physicians. First of all, what I recommend is that older adults make a list of all of the things that they want to talk to with their physician, okay, before they get into the doctor's office. One of the characteristics of communication patterns when we get older is that our sentences are longer and we have fewer breaks in between the phrases. So it's hard for a physician to get a word in edgewise when you start having that conversation in the doctor's office. And these physicians get very, very frustrated because they can't efficiently conduct their interaction with the patient. Okay, so it's very important that the patient come up with a list and make a copy. You have a list for yourself and you give your doctor a list so that the doctor can go efficiently down the line asking what the problem is. Another reason for difficulties with communicating in the doctor's office, and you've probably even experienced this yourself, is that you get nervous once you get in there, and that anxiety blocks your memory, as we were talking about earlier. And so just having that list helps to jog the memory. Another thing that I might suggest, and it depends on your mother's mental status, is that she allow you or your wife or another family member to accompany her in with her to the doctor's office, even for the exam, if she doesn't feel that that's an invasion of her privacy, because very often the physician, even during the exam, will be asking questions about symptoms, and in the nervousness of that, the patient is likely to give or liable to give misinformation. And sometimes, in addition to giving misinformation, patients are embarrassed about telling the physician something or feel that they don't want to waste the physician's time. And as a result, if there's another family member with them or friend, they can serve as a counter to the information given. They can correct misinformation or they can add things that need to be added. So I recommend two basic things then in summary. One, go with your mother or have someone go to the physicians. And then secondly, make sure that the physician gets a list of the concerns.
Okay.
Well, it looks as though it's about time to wrap up for the day. Let me just summarize some of the things that we've gone over today, because we really had a good session. First of all, we are going to, or you, Thelma, are going to have your husband assessed by a physician, it sounds like. And you're going to try, Mary, some techniques to try to get your mother-in-law more interested in food. And Jim, you, as I understand it, are going to bring all of those medications into your mother-in-law's physician. Does that sound like what we talked about? Okay. And the last thing is we are all going to drink 8 glasses of water a day, right? Okay. I'm looking forward to seeing you again next month, and I really hope that some of these things that we talked about today help. Thank you.
Talking with other caregivers in a support group like we've seen here today can provide valuable information. Sharing the frustration and joys of caregiving can be very helpful. Not only to you, but other caregivers can learn from your experiences. Also, knowing that you're not alone can bring comfort. To locate a support group near you, contact your area agency on aging, or your doctor may know if there's a support group close to you. Now, if there's not a support group available in your community, why not start one of your own? Your area agency on aging will be happy to help you. There are other resources available to answer your questions besides your family doctor, including your pharmacist, your lawyer, or your home health nurse or aide. Additional resources in your community may be home health agencies, a caregiver support group, a nursing home, home extension services, and the Social Security office. Recognizing the differences between normal age-related health problems and those problems needing special attention can be difficult and frustrating for caregivers. It's not always possible to know all the answers and make all the right decisions. But asking questions and seeking information when faced with a healthcare decision can help. You, the family caregiver, are an important person. The care you give your loved one is a priceless gift. So keep up the good work.